hazardous materials in a long-term care setting. Remember we used to have that red MSDS book? Okay, they've taken off the M, although several websites that I've gone to are still using the M. Material Safety Data Sheet. Now they made it easier, safety data sheets. What's in here?
The ingredients to the chemicals that we use to clean with.
Yes. And I guess what to do if somebody got some on them or something.
Exactly.
Yes.
This is what this book is for. Say someone was, after you give a shower, how do you clean the shower?
Sanitizer.
Okay, the sanitizer in the spray bottle. Say it sprays back in your face and it gets in your eyes, you don't wear glasses, what would you do?
Go to the eye wash station.
Then the next step is someone could pull this up real quickly and find that sanitizer in here. And if I knew the name, I'd look it up. And it would tell you exactly what to do. It would tell you whether you need to continue to wash, it'll tell you how long to wash it out. What else will it tell us?
Need to go call poison control or go to
Poison,
the
yeah, that's
ER.
Very good. Call poison control, and poison control number should be in the front of this. It's not. And then it tells us what to do in case of medical emergency. Contact your local poison control center. Eye contact, immediately flush eyes with plenty of water. Okay, so that's what the SDS book is. Another biohazard that we have are flammables. And flammables are what?
Oxygen tank.
Oxygen tank, okay. What are safety precautions when a resident is on oxygen?
If it's on their chair, they have a certain bag that they go in on the back of the chair.
Okay.
Not dropping them. You try not to drop them.
Right, don't drop them.
Don't drop them.
Grab it up by its lid, hold the whole thing.
Hold the whole thing.
No smoking around them.
Yeah.
No smoking, exactly. It really frightened me because they had all those tanks back there behind. People were dropping their coats over them, and I thought, oh my gosh, if there was a fire, we could never get these all out of here. There's an electrical box right behind that wall, and I thought, ooh, this is not a good place for these, and I'm glad they moved them. Okay, so that covers SDS, flammable, and did you know, and they used to really push this, and they're not anymore, and that is you should never use Vaseline around oxygen. You know why?
I guess it's flammable.
It's flammable. It's a petroleum product. Anything that's a petroleum product should not be used near oxygen. One of them about had a heart attack. I walked into a hospice room one time, and sitting in the chair was this lady smoking. And next to her was an aroma candle burning, open flame. And in the bed was this lady who she didn't have a concentrator on. She had the oxygen tank with it blowing in her nose because she was having trouble breathing. And I thought, they're just waiting to blow this room up. So they said, well, somebody said it was okay to have an open flame. I said, no, ma'am, it never is in a room with oxygen. But years ago, we had oxygen tents. We used to put people in oxygen tents because we didn't have masks and all nasal cannulas. And we were always told over and over, do not put Vaseline anywhere in that patient's face, their nose, their mouth, in that oxygen tent because a spark could set it off. And the oxygen tent would blow up.